Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in today to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. I'm really pleased today. My guest is Sonia Galvin. Sonia is the Senior Director for Health IT Testing and Certification at the Drummond Group. Drummond is an ONC Authorized Testing Laboratory and Certification body, as well as a leader in regulatory compliance, security, and risk management. Sonia has been with Drummond for over 10 years, and prior to that, she was a systems and interface analyst at US Oncology. Sonia, welcome to the Tate Chronicles.
Thank you. Glad to be here.
You know, there's quite a few things I want to touch on, so let's just jump right into it. We know developers for health information technology vendors, for anybody interested in certified technology, we are on a timeline that had to do with the Cures Act and the updates. Mm-hmm. And some of these updates are due in December 22. Can you tell us what some of those things are that we're going to need leading up to this December deadline?
Yeah, absolutely. So most certified developers have not yet fully updated to Cure. So we definitely anticipate this to be a busy year. Some of the updates include US CDI, and that's going to impact a lot of the criteria that are certified for developers, such as like your transition of care, a care plan, APIs for all data requests. There's several criteria that US CDI impacts. Additionally, e-prescribing. There is a new requirement for e-prescribing under Cures, so that's going to have to be updated. And then we have also new API criteria, G10, the standardized API. And so also going to affect a lot of developers. So again, as you mentioned, December 2022 is the deadline to have that tested and certified.
You know, one of the things about that, let's talk a little bit first about that requirement for the G10, which is really an attempt, I guess, to bring standardization to APIs or standardization to ways, more efficient ways to access, I guess, clinical data on a patient from otherwise incompatible systems. And so we've had the capability with the CCDAs to maybe pull a patient's record, but if you only wanted to maybe pull their medication allergies or their diagnoses, you couldn't. You had to pull the whole thing. So is that the main advantage of employing the FHIR standards? You can be more selective about the data you pull?
Certainly. And actually that was part of the ONC's 2015 edition, specifically around G8. That was a data category request. But G10, the new criteria, right, so that is going to replace G8. And so being able to have a health AT products respond to requests for single and multiple patient access. So, and it goes a bit deeper than what our previous API criteria did. So I think kind of what you're getting at is where it's focused more so on the data and the CCDA or the full CCDA. But here we're also testing against authentication and authorization. There's requirements for authorization server, even revoking access based on patient's requests. So a lot more involved here. And yes, it is based on a new FHIR Release 4. And as I mentioned earlier, we do expect that to continue to evolve. And so more testing and more focus certainly around APIs and patient access.
That's one of the, I guess, questions I have about the G10 testing. And I know you've already done some. There's already some certifications, testing certifications that have been awarded for G10. Is this done through attestation or is this an actual live test?
Yeah, good question. So G10 does require live testing. We will be using the Inferno test tool. There is another alternative test method in the works, so that one's not finalized yet. So as of today, we do have the Inferno test tool available. It is publicly available to anyone and you can get the link through the ONC 2015 Cures Test Procedure website. But yeah, so developers who want to test and certify to G10 will need to schedule a live test event. Also keep in mind that some developers may be opting to use a third party. And developers may use that third party during testing, and we can still add the G10 under their own certification. Or if the third party is already certified, developers can also just take advantage of that if they were to integrate and work along with the third party who's already certified. So there's some options there. Right. But if a developer is seeking to have that criteria added under their own listing, for certification, then a live test is required.
From what you've seen so far, how long does the live test take for somebody who's well prepared?
Yeah. So for G10, on average, I would say it takes probably about 3 hours to go through that. Certainly a lot of steps for the Inferno test tool. So yeah, approximately about 3 hours.
And so does that include it's all positive as well as negative testing?
Yeah, I would say so. And certainly test time depends heavily on the developer, and certainly trying to answer any technical questions developers have prior to the test event, just to help make sure that they're fully prepared. Okay,
thanks. Well, I know there's also, beyond functionality, there's some new biannual attestations that certified things have to happen. Tell us a little bit about those requirements for the biannual attestations.
Yes, and that was really important. So that one's coming up in April. So biannual attestation, it's a new attestation process. This was introduced as also part of Cures. And this is where developers will attest to meeting conditions of certification, such as information blocking, assurances, communications, etc. And so this is going to be a different process because ONC is going to be managing this. Developers will actually log into the ONC Chapel website directly in order to attest. Yes. Okay. And so the time, this is really good because actually next week, ONC is going to start emailing developers invitations in order to access the Chapel website. So developers should take a look at their certified Chapel listing to ensure the contact information and email there is still up to date. If it's not, and they are a Drummond certified developer, they can just notify us at certification@drummondgroup.com and we can update that. Otherwise, developers should contact their ACB directly if any email addresses need to be updated. Okay. So the plan is, so ONC will send out the email invitations to developers starting next week. So developers will be required to log into the Chapel website in April. It opens April 1st and will continue to stay open until April 30th. So they'll log in, attest, and that will meet the requirement for that attestation. So real important, developers want to stay on top of that.
Sure. One of the attestations you mentioned was around information blocking. And I believe there's some type of deadline coming up regarding that in October of this year. Are you aware of that? What's that deadline about for info blocking?
So in October, this is when developers should have, or the product should have the capability to send against the full EHI definition. Okay. That is the requirement. Now, there's a little bit of a gray area in that most developers are probably aware that they don't actually have to get certified to the new EHI export B10 until 2023. Okay. So there's an extension there for certification. However, adherence to sending against the full EHI definition does start in October. Okay, that's helpful. Well, let's just kind of speak to a moment about the work that health information technology developers, some of their concerns and issues for 2022. Obviously, everybody's always doing development, but development related, they have to sometimes run two tracks. One track is keeping up with the certification requirements. So maybe last year there was no need for a high level of deploying resources to certification and development, but really is this year because they have to get ready for some things. Yeah, absolutely. So, just a moment ago, we listed some of the criteria that has to be updated for cures. So yes, December 2022 is the deadline. And then obviously development around G10, a standardized API, if developers are going to be developing that on our own and having native technology adhering to G10. And then additionally too, now we have the real world testing. Submitting the test plans was certainly an undertaking, I know, for developers, and even here in the ACB side, having to review all of those. So that's something developers have to keep in mind. That's an ongoing annual requirement to have those submitted. So this year is definitely going to be a busy year for our certified developers. So again, we have our biannual attestations in April. We have the Cures updates that have to be certified by December. We have real world testing. And then, of course, G10, which does require live testing. So, yes, it's certainly a busy year for developers.
Let's talk about real world testing just a little bit there, because there has really been a desire and need for that for some number of years. A lot of providers said, well, okay, these EHRs can probably do a pretty good job in a pristine lab certification testing environment, but what about in the real world? So we've got now real world testing. And since we're just in the first yearly cycle of that, everybody's doing it for the first time. The certification testing bodies, the developers, everybody's doing it for the first time. The government's doing it for the first time. And so some of the questions I sat through some of the CMS or ONC webinars, and one question I never really heard an answer to was I know that if a applicable criteria was certified before this last August, maybe before August 31st or 15th, not sure what it was, that they had to do real world testing. However, some of those folks who had gotten certified didn't have any customers yet. So how could they do real world testing with customers when they didn't have customers? And nobody could really, I'm not asking you to answer that. I'm just saying that's an example of, we're kind of in this gray area.
Right.
And even some of the things, the real world testing planned, some things could be done. They had to be some real statistical analysis. Sometimes it could be done by a survey, and then the guidance changed. So I guess guidance is continuing to change on that.
Yeah, so those are really good points to make. So, so your first one in terms of low adoption rates, that was certainly a hot topic here that we had at the ACB. It really shed light on where we are in terms of capability, usage. So a lot of developers actually approached us with that very question. What do I do? No one's using this capability. So there were some ways they had to get maybe a little creative about their measures, but also just stating that fact. That's what this is about. It's shedding light on that. And again, it impacted, I mean, this was so many developers that approached us with this. So I think certainly that's going to be really eye-opening as folks are looking at these real-world test plans as well as ONC. Also, just understanding the expectations. Developers were not quite clear on some of the guidance that was produced. And so I think ONC did a really good job by releasing the resource guide that they did. That did a lot of clarification. So I know we relied on that heavily as well as we were doing our reviews of the plans. In the end, I think developers did a really great job just providing just that analysis and background on their products. Again, it was eye-opening for us as well. I mean, we work with developers so closely with testing and initial certification, but it's the testing has shifted. It's not, you're not doing as much live testing with your test lab anymore. It's shifted to real world testing. So the focus is on developers to really, putting out their own information. And so we're really impressed by how comprehensive and in-depth some of the analysis was. But again, yes, a lot of low adoption rate out there, but that's what we're working towards, interoperability and having folks take advantage, providers and patients taking advantage of the technology that developers are using.
One other thing, I don't know if it was intended to, but maybe it's just a silver lining of real world testing. But even if during real-world testing, it becomes apparent that adoption of some of these interoperability criteria and actual usage is extremely low, well, that's data point number one. As it's done every year, we can see where those numbers change and see what kind of adoption is actually taking place. Right now, everybody's just guessing. How many CCDAs are actually being exchanged, how many APIs are actually being utilized, things like that. So there's some potential for some real data to come in, I think.
There is, yeah. We're real excited about that. So analyzing data logs and seeing what's actually being exported and produced, yes. So that's, we're going to see a lot of that. So certainly eye-opening.
Now, I know beyond just the ONC certification criteria, Drummond does other types of certification. Tell us a little bit about that.
Yeah, we're very excited about that. So currently, we do have 2 other voluntary certification programs, at least under this side of the house for health IT, in that Drummond recently introduced a new fire testing and certification program. We partnered with Aegis to establish this voluntary program. And this is focused on the payer community in order to ensure compliance with the CMS interoperability final rule, patient access final rule. And so that's going really well. We have a number of developers already tested and certified under this voluntary program. So we're very excited about that. It uses a touchstone testing platform. So it's fire testing, and it's based on the HS7 fire standards. Additionally, Drummond has a pediatric testing and certification program that is soon to be released. So we're real excited about that. Our anticipated public release is the end of this quarter. So so possibly late March. You'll hear more about that from us. But essentially, this program, it centers around the pediatric health IT requirements that are outlined in the children's EHR format, as well as the ONC recommended 10 pediatric care capabilities. Covers things such as newborn screening, well child visits, bright futures, weight-based dosing. So we're real excited about that. And additionally, actually next week, HL7 work group meeting is going to be held to review and approve a new pediatric functional profile. And so that'll also serve as a basis for our program. So currently, Drummond is actively recruiting developers who would like to participate in the pilot program for pediatric testing. And so if anyone's interested or has any questions at all, our Director of Strategic Healthcare Initiatives, Timothy Bennett, can help them with that. And he can be contacted. Yeah, Timothy at drummondgroup.com.
Okay, and so this pediatric certification, this is a non-ONC, but a Drummond-based certification, just because you see the need there and because the standards have been already published, essentially.
Absolutely. Yeah. Yes. It is a non-ONC. It is a voluntary program, but similar to how Drummond supports our ONC clients, there will be a support team available, answer questions. The testing and certification process looks a lot similar to what developers may have gone through under the ONC side.
You know, there are all these new types of gathering health information platforms, telehealth, remote patient monitoring. Do you think that we'll start seeing certification in other areas like that?
We have discussions about that internally quite a bit, and we have client developers coming to us asking for specific certification or programs, right? So absolutely, I think that's definitely something we'll continue to see coming.
And based on, of course, government regulation is the main sail that drives this ship. There's no doubt about that. And so I can remember before meaningful use and the really ONC authorized testing bodies, in particular CCHIT, before when they were still active, they were starting to do, of course, they started with their own certification. And then they were getting ready to do ones on personal health records, PHRs, certifications, things like that. But then meaningful use came in, and the ONC base EHR, this is going back years. And so things, all those kind of collateral certifications got pushed somewhat aside. But I'm thinking that certainly COVID has pushed the whole idea of telehealth, telemedicine, remote patient monitoring. Technology is so advanced that it'd probably be good to have some standards around those things more than we have now. Yeah.
Right. Absolutely. Yeah. And certainly that also, as you mentioned, having those standards developed can certainly drive testing and certification as well. Yeah. So.
One of the things I remember in the early days of certification, developers would often come up against some functionality requirement for certification. And they say, why do we need to have this in there? And a good example would be, this may not be a good example, but one example would be immunization registries, things like that. And so it was easy to say at that time, listen, if we ever have a bad pandemic, you can be glad we got immunization registries. Well, we had the pandemic, but I'm not so sure that there was a process or workflow for that data to flow to where it was needed to know really what was going on, certainly in the first year. So it's not only the technology, it's the workflow and preparation to use the technology, for sure. The HIMSS this year is going to be in March in Orlando. Is Drummond going to be there?
Drummond will be there. Yes, we will have representatives as we have in several years past. So we will have a booth available. So we certainly look forward to meeting with clients and answering questions. But yes.
Okay.
That was never common staff.
Okay, and so probably the easiest thing for them to do is just come by the booth, look in the listings and the agenda, and just come by the booth there. I remember last year, I believe, either ONC or CMS or both of them, neither one was at HIMSS this past year. I know Drummond was there.
Right.
Do you expect any major announcements 2 months from now at HIMSS from the government level, or all the big shoes have already dropped for the next year or so, hopefully?
I would say so. I would say the latter, yes. Given, again, that we know that the compliance deadline for cures is this year, and we're already underway with real-world testing, we do not anticipate any new announcements this year.
Yeah.
Cross my fingers, because we're all pretty busy at this point.
Well,
but
I know it, and certainly we hope there's more continued clarification and guidance coming.
Absolutely, and I will say yes, I do know that that's in the works. So more clarification on guidance, specifically around real-world testing, and for the results submission. Our results submission starts in March of 2023. That's when they're due, and so ONC is planning to have more guidance about the results submission this summer. So we're really looking forward to that.
I guess since we're in 2022, the rural testing plans that were due to be on the chapel site, some folks may have said we're going to go ahead and do our testing and report submission possibly in the first quarter if they're so anxious to do it. So y'all can start getting those really in the next month or two, couldn't you?
For the plans, you mean? I'm sorry.
Not for the plan, but for
the results.
Yeah, for the actual report.
I don't anticipate we probably would get anything that early. A number of developers have set several months in the plan to review data and to provide analysis on that. So most folks are looking at multiple quarters or 6 months range.
Sure.
So, So we're still expecting probably towards the end of the year to start seeing those.
Yeah. And I think a lot of the documentation folks that are involved with developers and vendors, they kind of like to wait till there's as much guidance in as possible before they start submitting those documents. Yeah.
Yes, very good point.
Yeah.
I actually have had a couple of folks who being very proactive and asked about results, and I was like, well, we're not quite there yet. So again, ONC guidance for the results submission should be out this summer.
Right.
But yeah, I think most developers we're talking to lately are really heads down and making sure to get the cures done, and also that G2 testing. So busy year for sure.
I'm sure. Before we sign off, Sonia, where can listeners go if they want more information on the Drummond Group?
Absolutely. So they can visit our website at drummondgroup.com. If anyone has any questions at all about cures, real-world testing, they can also reach out to us at certification@drummondgroup.com.
Okay, great. Well, to our audience, thanks for joining us today on this episode of the Tate Chronicles. I offer special salute to my guest today, Sonia Galvin of the Drummond Group. Sonia, thanks for coming aboard today.
Thank you, Jim. Appreciate it.
You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.